Okay, this video is from the book John McDougall, the Doctor Who Fought for You, and this is Dr. McDougall on cancer, what he had to say about cancer. So Dr. McDougall emphasized that a cancer cell can be characterized by the doubling time. And let's say doubling time of 100 days is rather typical. So that means it would take, to get 100 days to become one cell to become two cells. And then for two cells to become four cells, another 100 days. All right, and the point of all this is that according to Dr. McDougall, he says that usually by the time it has doubled 64 times, it will already have metastasized to bone, to lung, to liver, lymph nodes, or somewhere far away. And this usually occurs before it's going to be detectable on imaging, either CAT scan, mammogram, or PET scan, or whatever the imaging modality. So what he's saying is that, based on his study of the literature, most of the time, by the time we can detect a cancer with any type of study, including all the screening studies, it's already metastatic. All right? And that means that the treatment plan has to include something that's going to address metastatic disease. Metastatic disease means distant spread from the initial site rather than local spread, just growing outwards. Okay? And here's the reference to where this paper comes from. Okay, usually it's going to have to be about 1 centimeter on an imaging modality in general before you can confidently say this is cancer. If it's much smaller than that, it's very difficult to biopsy. And one has to also distinguish, even a PET scan can be positive, I've increased avidity uptake for an infection, for example. So here's what Dr. McDougall says. He says, cancers often double in size about once every 100 days. Thus, the cancer has already been there about 10 years typically before it reaches a size at which it's detectable, about 1 centimeter. We usually can't see it or confidently call it a cancer until the tumor is at least 1 centimeter in size. PET scans, positron emission tomography, they usually can't detect a lung cancer until it's about 1 centimeter or larger in size. But when it's smaller, you'll just follow up CAT scans to see if it's growing or not. And even when in the early phases, it's hard to distinguish the difference between a 4 millimeter nodule and a 5 millimeter nodule. And the slice profile of the CAT scan can make that a little tricky to tell initially. Is it really getting bigger or not? So you're going to have to get another follow-up CAT scan. Okay. Sub-centimeter lung nodules are very common, and the vast majority of them are benign. It's routine to call them sub-centimeter, subpleural micronodules and just assume that they're not cancer. But you never know initially. Okay. If cancer is going to metastasize, it will usually have metastasized before it reaches 1 centimeter in size. Metastases tend to double at the same rate as the primary tumor. This is the typical growth of cancers. Prostate-specific antigens doesn't usually become positive until the prostate tumor is about 1 centimeter in size. Mammography-detected tumors usually have been growing for about 14 to 17 years before they can be detected. The average doubling time for a breast cancer is about 100 days. On average, a breast cancer takes about 6 years to become 1 millimeter in size and about 10 years to become 1 centimeter in size. By this time, if it's going to metastasize, it probably has already done so. The point is that so-called early detection, like mammography, is really late detection. In other words, after metastases has occurred. And this means that local treatments like surgery or radiation are unlikely to be curative. They treat the primary cancer, but they do not treat the metastases. There's some exceptions. There's some tumors that are less likely to metastasize, like brain tumors are less likely to metastasize. Okay, another key point is that cancers usually metastasize first to the veins, not to the lymph nodes. Okay. Thus, the surgical removal of adjacent lymph nodes usually doesn't do much to affect the prognosis. So you understand that, like for breast cancer, what he's saying is, let's say you do a lumpectomy to remove the primary mass of a breast cancer. What Dr. McDougall is saying is that it doesn't do you much good to go after the lymph nodes in the axilla, for example, because you've already got distant metastases most likely, and whether or not the patient responds to treatment for those distant metastases is going to determine whether or not they live. That's what he's saying. So he's saying, why do removal of the lymph nodes when it's not going to change the prognosis, and it's going to potentially give you side effects like swelling in your arm, for example, lymphedema. Okay, Dr. McDougall continues. Doctors used to think that cancer spreads primarily to the adjacent lymph nodes. However, the idea of the centripetal spread of cancer theory suggests that cancer tends to grow outward from a central source. However, that is often incorrect. In reality, it more often, if it's going to metastasize, will spread initially to the veins and can quickly go to distant sites. And this is also why local therapies are not as effective as was previously thought, per Dr. McDougall. And then he has a bunch of references here. Okay, these are just the references, and we'll just call it at that for today. So I hope that was helpful. You can go to drmcdougall.com's website, and you can see his newsletters and his videos on cancer. You can also go to Dr. Mcdougall's YouTube channel, Dr. Mcdougall Medical Health Center, and you can see his videos and his other lectures on these topics. I hope you find that helpful.